July 28th. This is Betty Ann Nettleton. I am the presiding chair from Elmore County, along with Representative Blanksmore from our county also. And I will call the meeting to order. And first in our agenda today will be our roll call. So I will call for Boise County.
Commissioner Sturm here.
Valley County.
Commissioner Hasbrook here.
Ada County.
Jane Young here.
Ted Epperly here.
Commissioner Laciando here.
Elmore County.
Representative Megan Blanksma here.
Okay, thank you, folks. And I will remind everybody, you've been doing a good job, but just prior to speaking, if you would state your name. We have had some comments in our emails about people not knowing who is actually speaking. Okay, moving on to the action items. Under number 3, changes to the agenda, I will defer to Russ Duke to add to this discussion.
Yeah, thank you, Madam Chair. Russ Duke speaking. We have a couple of additions to the agenda since the focus of our conversation today will be around schools and reopening plans, and also a clarification in the existing public health orders for who the mask order applies to as far as schools. So in addition to Debbie Critchfield, the president of the Idaho State Board of Education, who was on the initially posted agenda, we also have Jim Foudy from McCall-Donnelly Schools. He's the superintendent. And David Reinhardt is joining us from CUNA Schools, and he's the assistant superintendent of school services. So with that, we need a motion and a vote to approve the modified agenda to include Jim and David.
Madam Chair.
Yes, if you will identify your person who's speaking, please.
Madam Chair, this is Commissioner Laciando. I move to amend the agenda to include Jim Foudy and David Reinhardt for presentation today.
Thank you.
Madam Chair.
Do I hear a second?
This is Jane Young. Yes, the second from Jane Young.
Okay. There's no further discussion. I will call for a roll call vote. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Laciando, aye.
Elmore County.
Representative Blanksma, aye.
Thank you. Okay, motion passes. Moving on to item 4 under new business, we will have vote on to approve the minutes from our July 21st board meeting, and I will need a motion for approval of those if there are no corrections or additions.
Madam Chair, this is Commissioner Hasbrook.
Yes, Milt, go ahead.
I make a motion we approve those minutes.
Okay, is there a second?
Commissioner Sturm,
Madam
second.
Chair. Yeah, this is Jane Young, aye.
Thank you, Jane. Okay, we'll do a roll call vote to approve those minutes. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Laciando, aye.
Elmore County.
Representative Megan Blanksma, aye.
Thanks, folks. Motion passed. The minutes for our July 21st board meeting have been approved. Moving on to item number 2, I'm going to turn this discussion over to Russ at this time to incorporate our 3 speakers into the discussion. Russ?
Okay, thanks, Madam Chair. Russ Duke speaking. So we are fortunate to have 3 guests with us today. We have Debbie Critchfield. She's the president of the Idaho State Board of Education, and she'll go first and be talking about the Idaho back to school framework. So as everyone recalls, in March, we had our first case of COVID-19 in Ada County on March 19th. And by March 25th, March 13th, and by March 25th, the governor had issued stay-home orders, and most of the schools had either closed or closed after those orders went into effect around the state. So we've had some time to plan. Unfortunately, our situation hasn't really changed as far as COVID-19 is still with us, likely to be with us for an extended period of time. And now it's trying to figure out, how do we manage in this new reality of a respiratory illness, where in our school district or our health district, we have about 75,000 students who will be planning to return to school here in just a few weeks. So I've asked Debbie to speak about this more from a statewide perspective, what it looks like, what the framework looks like from a high level. And then we have two guests from our school districts here in Public Health District 4, Jim Foudy representing a rural school district in the McCall-Donnelly area. And then David Reinhardt has joined us. And I guess it used to be a rural school district, but hardly anymore for the CUNA school district now that area has seen such growth. So they'll each speak to the board about exactly what they're planning to do and how their plans will interface the statewide framework, and all three will be able to answer questions. And Madam Chair, I don't know if you want to have Debbie and ask questions, and then Jim, and then David, or if you prefer to let them all three kind of do a brief presentation and ask questions, but that's up to you. Thank you.
Thank you, Russ. Well, Debbie, why don't you lead off with the discussion, and maybe Jim and David can join in.
Okay. First of all, as Russ said, I'll introduce myself again. My name is Debbie Critchfield. I am currently the president, but I have been a member of the State Board of Education for the last 6 years, and most recently chaired the governor's reopening committee and was a member of the governor's K-12 emergency council. As schools closed in the spring, it became apparent that there was some support that was needed as boards were making decisions. I know we're here to talk about the reopening, but I always feel that accurate information is in order. Something that has been confused with what happened in the spring, the governor nor the board directed any school closures. All the closures that were made were done by local boards. Where the Board of Education stepped in was to help districts as we heard from them, okay, we've closed and then we have a stay-at-home order. How do we know that we can get back into school? And so the guidelines for reopening in the spring were intended to support the local decision making on when and how school could be back in person. School out in the sense of no delivery of education. And that gets muddied a little bit, especially when we talk about reopening for the fall and what role the State Board of Education had. So I guess I want to start off by saying that the reopening framework was designed to support local governance while boards are making educational decisions for their students. And I think this is an important point of understanding that I want to get into in just a minute. The State Board of Education wanted to assist that decision making, similar to how we did in the spring, by providing a tool that could be applied uniformly without specific operational mandates. So we worked to develop a document that could be used as decisions were made about how to best support learning in our current environment and what types of considerations needed to be thought through to make learning successful and comprehensive. We had hoped to keep it to about 10 pages or so, like some states were able to do. But as we got to work, we also identified and wanted to cover areas that other states did not. An example of that would be emotional health of students or assessing student achievement. Now, I don't want to go through every aspect of the operational areas, and I don't think that you expect that. Clearly, you have seen and have been able to read what those recommendations are. But what I would like to do is provide a bit about the process and participation and the intent. As a group, we worked on various areas for several weeks. That included reviewing national and state recommendations, other state plans, looking at what districts were grappling with. The main committee involved more than 24 people at every level of the educational process and operations. And then we did break into smaller subcommittees so that we could make even more perspectives beyond that. Now, I'd like to highlight the fact that when we talk about reopening, we as in the board talk about reopening, what we're talking about is guiding the decision-making for providing instruction, whether it's in person, online, or some type of hybrid. So it's not a matter of whether schools will provide learning, but best do it within their own context. And so the framework was intended to generate individual and comprehensive plans with known best practices. So public schools will be providing instruction even if there are no in-person courses. And their plans are supposed to include how and when in-person instruction will be provided and what safety protocols they have in place. As you might imagine, we've had, as a board, we've had serious concerns about equity and reducing the widening educational gaps. And we're listening to districts and educators talk and share their concerns about the lost learning time that we've had from the spring until the start here in the fall. So districts have an obligation to teach students. They know this, and this is the focus of their work right now. I want to point out that the framework does not direct individual school plans to be based on local health orders. Now, they are directed to focus on the delivery of education. And I think that this is an important statement and an important distinction. So the framework establishes that local health districts will identify which category of transmission their schools are in, and then the boards will develop responses based on the level of community transmission. Now, if a city or local health district places specific restrictions in place, like wearing masks in public places, schools are subject to those additional restrictions, but fundamentally based on levels of transmission, not individual local restrictions that may be in place at any given time. So school boards are to make the educational decisions, determine their responses with input and consultation from public health. This is how we entered into the process of getting the framework. Now, I'd like to be a bit unvarnished here, I guess, and say that our board is very much aware of the push and pull of the statutory authority in 33.512, specifically subsection 7, and I know that you're all familiar with that. And we're aware that different approaches to the same problems are causing a lot of concern for some, and yet there are districts who would like very prescriptive directions and others that, want us to lose their phone numbers. They want to make these decisions. So I would add to this list the fact that, some out there believe our board hasn't been forceful enough, and others think that we have gotten out of our lane. So looking for that elusive sweet spot is very subjective. And everything about our framework was intended to invite collaboration and conversation within communities. And that means everyone from priority advisors, such as public health and other healthcare managers, to business leaders, parents, students, staff, patrons, etc. The framework supports locally elected boards as the ultimate decision-making authority for delivering education in their communities. Now, I am confident that boards and superintendents are looking for everything that they can, everything they can find to inform their decisions, even when there's conflict on how to address this issue. And we've seen some great examples of partnerships and relationship building, but we've also seen breakdowns and stalemates. And we have asked boards to make some incredibly challenging decisions, and we're hopeful that our framework sets milestones along that road. And then finally, I would say this. I believe that that all of us that are talking about this, that we have shared goals for outcomes. And the approaches may be different because our situations are different around the state. But our board is encouraging and publicly advocating that the decisions that are made involve other people. So with that, I will stop talking, and if there are questions, or however you want to approach the questions.
This is Chairman Nettleton. Does anybody have any questions for Debbie at this point in the discussion?
Madam Chair, this is Elt.
Yes, Elle, go ahead.
Debbie, what's the feeling that you're getting from the teachers and the Idaho Education Association, and how is their input taking on some of these decisions as well? Because it seems like that's a lot of the text and emails that I'm getting is from teachers that are concerned about their health.
So I think you mentioned, and I think rightly so, teachers, and then because we know that not all teachers are members of the union. And I think that our state union has come out strongly, of course, advocating safety within the classroom and within the school setting. There is not a school board or a superintendent or administrator out there that doesn't also have that as a priority. Now, just if we're talking across the board teachers, it varies depending on where you are in the state. Now, in my area, Region 4, Magic Valley area, the teacher side leans towards reopening. We know that there needs to be precautions. We know that school districts are working to ensure. I think that it leans towards let's get back to school. Now, that's not the same everywhere in the state. I think that there are as many opinions from teachers as there are citizens in the state. And teachers, I think by and large, recognize the value of getting back to school, whether that's in person or, in some form, that be supported. I think the anxiety and the nervousness comes because there isn't anybody, and I don't care if it's education or otherwise, that can confidently say, you come to work and we can guarantee this, this, or this. And schools are no different than that. And you're going to hear from some superintendents here, and they'll speak to it more fluently than I can. But I don't know of anyone that hasn't been working since school since we had our soft closure in March, to identify what type of physical needs need to happen in the buildings to make sure that our teachers feel safe. Schools have been buying all types of supplies and making every effort that they can within their resources to make sure that staff feel comfortable. Sorry for the long answer.
That's okay. I like long answers.
Madam Chair, this is Commissioner Laciando.
Yes, go ahead, Diana.
So thank you again, Debbie, for joining us. I really appreciate having you here, and really appreciate about the back to school framework is this page that clearly outlines the different roles and responsibilities and the statutory authority related to that. So I just want to make sure I'm kind of framing this up correctly. Responsibility to, and I'm really doing this not only for us, but also the public. It's our role and responsibility to define which phase of transmission we're in, whether it's minimal to moderate or substantial. And then the school boards will subsequently take that definition and make their decisions. Am I framing that correctly?
Yes. When our committee worked and how we've explained the partnership of public health and local boards, educators, there isn't anyone in education that is trying to say that, well, we understand the public health and the science better than someone that's doing that professionally. And so we wanted to use the people that were experts in those areas. And so as a local health district, and I'm going to share the ideal, and we do have examples of this, and as I said before, we have examples of this not working. But the ideal situation would be public health comes to the table with the superintendent or the board and says, based on these factors that are known factors, we believe that our community, our county, our school district, whatever, is in yellow. And this is what that means. And this is what we think would be useful for you to know as you make decisions about educating children. And that public health shares their information, consults with them, gives them the recommendations on here are some ways that we think that you could enhance how you're starting school to make sure that you can stay in school longer. And then the board takes that information and they look to say, all right, this is a category that we're in. And then they make the determination on how they can satisfy the information that you've given them. What's the best way that we can deliver the education? You all know this. I mean, board members are locally elected. They're living next door to the people that elected them. And so, I have to, in full disclosure, say that I was a former local board member for 10 years. And so I appreciate the political nature of being in that position. And they're going to look broadly, just as you do, in making some of those decisions. And so, again, I'm sorry for the long answers, but public health makes a determination. This is what we know, and here are the factors that are in play. And then that information is shared with the local board. The local board then determines the best delivery of the education, recognizing that their number one is safety as well. You didn't ask me this, but I'm just going to say this. I find that it's unfortunate that there has been some real messaging or perceptions that if you want to start school, you're discounting public safety. And that is simply not true. I haven't heard or talked to anybody involved in any of these decisions who has said, we are reopening at every cost. We don't care about public safety. Those two things are not exclusive of each other. Our districts, yeah, they want to have in-person school, but they also want to be safe. And so they're approaching it from both sides. And so when you're able to provide that information, it's an important piece of their overall decision making.
Madam Chair,
Yes.
this is Representative Blanksma. May I ask a question, please?
Yes, Megan, go ahead.
Hey, Debbie, I want to applaud you because this is the first time we've had a speaker that has provided a set of qualified standards to base decision making on, and I think that's fantastic. I like to see that there are reasons from going from one step to another, and I think that it was really clearly outlined and well thought out, and thank you for that. This is the first meeting where I've really felt like there are some standards being applied to some of the decision making, so thank you. I do want to ask you, with regard to these standards, when you're getting pushback from individual districts, are you getting pushback on having the different stages, or are you getting pushback in the quite a few districts want a very specific outline of what behaviors need to occur within their building? And how would you, like, proportionally, what do you think that looks like, if that makes sense?
I think, well, there's two sides to this. One, I'll start with your second question first. We do have districts who were disappointed that the framework wasn't very prescriptive. If this, then that. And this is exactly what your operations should look like. This is exactly how you should do it. It should be statewide. And the reason for that is, well, this is my conclusion for the reason for that. People are scared. People are scared to make decisions, and I don't blame them. I mean, it's no fun being a leader right now. And I know that I'm not trying to, minimize that, but it's hard to be a leader and to step forward and put your neck out there and say, look, we know that it's important for school to start. And so this is how we're going to do it. And so I think that, that there's just every help that we can get in the world. Now, the category part, which was the first part of your question, I have not heard of a district that doesn't appreciate the categories. That helps them make decisions. And so I was able to sit in a room with my local district, with the liaison that had been assigned to our district from our public health. And it was a fantastic conversation on, okay, this is how these are the factors that we're looking at and the inputs that we're looking at. This was our public health lady. This is what we're looking at to determine the categories. So right now we know we're in this category. And then we could talk about, as a school district, there were parents and administrators and people in the room. Okay, within this category, here's where we have some room. This is what we could do and what we couldn't do. And if we progress and if we move here to here, here are some options on how we can respond. And so I mean, there may be exceptions, but I haven't heard or talked to anyone who hasn't appreciated the categories part. It helps guide. And again, boards want help and they want input. Some would like more because there may be more anxiety or more unknowns, or they're less comfortable with the unknowns. And then of course we have some that say, we don't even want you to tell us anything because we've got it covered. You know, we think we can handle it. You guys want to invite me back because my answers are too long. I'm sorry.
No
Madam
apologies,
Chair,
Debbie.
if I may.
Chairman Nettleton, any more questions?
Yep.
Yes, Diana?
Thank you. So, Debbie,
Go ahead.
sort of the framing done. One of the things that I don't have much visibility into is what resources individual school districts are getting, either from the feds or the to either be adjusting their educational delivery model and adjusting for additional cleaning, face coverings, hand sanitizer, other supplies they may have or need of. And it's my understanding that some of them are able to cover that and others are struggling. So if you could kind of speak from your perspective on what those resources are, that would be helpful.
Stimulus funds have been a contributor to supplementing what local resources aren't able to provide. There's so many acronyms for everything, but the board and through the governor's office, there have been requests to help with PPE and masks. So we know that the stimulus funds coming into the state have been agreed to. That's money that the governor has and his committee, which CFAC, I can't even tell you what the acronym stands for right now, but anyway, those things have been or will be available to school districts. From FEMA, of the department and the board have worked with General Ritchie. He's been very much involved with the Division or Office of Emergency Management in getting thermometers. We know that we've got thermometers and masks and these types of things. And so every agency that has any type of access, whether it's funds or direct supplies, I mean, and anything from plexiglass, that's something else that's been in short supply. So we've been listening to what district needs are and then looking in every corner that's available, whether it's stimulus funds, state funds, local resources, federal monies, to try to help that. Now, that isn't to say that, hey, we're good and we don't need any more help. We're counting on additional funds. And I think once schools get back into their operations, they will also help us know those deficits are.
Thank you. This is Chairman Nettleton again. Any further questions for Debbie? Or?
Madam Chairman, this is Ted Epperly. A couple questions.
Yes, Ted. Go ahead.
Yeah, Debbie, again, thank you also for joining us today, framing this, being a leader, stepping forward on this. This is difficult, and it's going to impact a lot of people. Three things just quickly for us to know, because I recognize that what we're going to do is provide general information on community spread, percent positivities, outbreaks, things like that, that will help inform local district school boards. And again, they'll make the decisions. I totally agree with that. I like the framing of it you used of education is going to happen. The question is how and when. And, you know, that'll be informed by data. So just a couple things in regards to this. In regards to the plans, I would assume that individual plans under the jurisdiction, or individual schools under the jurisdiction of the local school boards will all develop plans that they will start to enact. And I would assume that all of them in a particular jurisdiction would follow the same plan. Is that right? Under a district, would all the schools under that district follow the same plan, or is there going to be individual variation amongst schools?
So we're talking within the same school district, correct?
Yeah, correct.
I'm not aware of anyone that has different expectations for different schools. And I think that that's an important distinction from the spring. I mean, we abruptly went into everybody's online, and that looked differently, and it wasn't awesome. And so we've learned a lot, and as schools are looking at applying their plan across the district, that's what one thing I want to point out here is that responses might be different school to school, even though everyone has the same plan in place. And I'll use my own school district, for example. We've got smaller, more rural schools that are quite removed from a more urban area. And if there's transmission, community spread, and you're 45 minutes away, it wouldn't make sense or as superintendent to have everybody go online because one school that's quite distant is dealing with issues. So as far as applying the plan, yes, various responses based on cases and transmission and those type of things. I think that you will see differences there.
Okay, and just as a follow-on, Madam Chair, this is again Ted Epperly. Has the State Board of Education or the local district school boards taken into consideration differing approaches for, let's say, high schools than they might K through 3 or K through 4th grade in regards to the impact that smaller children have with the disease and their impact on adults versus older children? Or is it a one size fits all for kind of all of those? It starts to strike me that there's so much variation when we talk about schools from K to 12 is it going to be something that they start to sort out in regards to some of those impacts, or is it going to be they'll get the data and they'll make a decision? The decision applies pretty much to all schools, maybe some degree of variation, but I would assume just for consistency's sake, it's going to be kind of a one size fits all in the district, and a high school would face the same thing as an elementary school.
I don't know how to answer that for two reasons. One, we didn't specifically direct districts within the framework on how to approach that. We did leave that to local boards to look at national guidelines, local public health input. I would expect that there will be differences on some of those things. Having said that, I'm also aware of school districts and let's, using the mask example, that said all of the students are going to use masks. I've seen everything from mandates to recommendations. And I think, and I believe that the decision making around that is reflective of what boards understand to be their level of community spread, the expectations in their community, what they can enforce. This is a huge part of all of that. I mean, I know boards are reluctant to put very stringent mandates into place, recognizing how am I going to enforce that? And so I think creating conditions where they can support good hygiene practices and develop protocols that appear to be more positive and proactive rather than walking around and making sure that, all of these things, if you're not exactly like this, what are they going to do? Expel a student because someone took their mask off? These are the types of decisions and the types of questions that boards are grappling with. And so I think when you see the variety and the differences, it's not because there's a lack of respect for science or a lack of respect for what professionals are saying. They're saying what is practical and reasonable and makes sense in our district, and what we could actually accomplish.
You just speak briefly to both cafeterias and busing in regards to how the districts are thinking about with their individual plans, those things in just a general way for us.
Lunch is easy. Taking groups of kids in at different times, working 1 or 2 classes in. This is what I'm hearing predominantly. Busing, as many school districts as we have, that's how many ideas there are. I've heard things from loading the bus from the back to the front out, having hand sanitizer available as students get on the bus, seating family members together and trying to, as much as possible. I would say those are the top general ideas of what I've heard.
Okay, and then lastly, and I'll be quiet, one of the real challenges that's going to happen during the school year is going to be testing. Because again, what's going to happen is just like it always happens in the fall and winter, and that is that we get hit with a fair number of viruses. There are going to be a lot of kids with coughs and runny noses, potentially even low-grade fevers, teachers as well. The problem is with testing, and we're facing that right now, is that it can take 4 to 10 days to get a test back. That's going to be a particular challenge when all of a sudden we're overwhelmed with a lot of students, a lot of teachers. It's going to put excessive demand on the system that even right now under no school is challenged. So any proactive plans the schools are having, or the State Board of Education, around point of care testing, so that we can turn around answers on sick children, within 15 minutes to 30 minutes or so, as potentially performed in the schools?
I would say that recently, in fact, last week I was on a call, and CFAC is Coronavirus Financial Advisory Committee, that there was a request for $21 million relative to testing. And I have been an advocate to have teachers be among the priority group. And so there were some priority groups that were established within the state. Clearly, healthcare providers and healthcare workers are up there. And I would argue in this case that there's some pretty good reasons as to why teachers should be bumped up into that group as well.
Thank you.
Any further questions for Debbie at this time?
Debbie, this is Jane Young. I had a question.
Yes,
Madam
Jane,
Chair?
go ahead. Yes, go ahead.
Do you get a sense anywhere, and from the people that you've spoken with, that there is a sense of cooperation and using the normal positive, hopeful energy that kids have, that there would be a sense of wanting to work together as opposed to needing to enforce?
I believe that people come to, and you're just talking about being in person in school, like getting back in person. I think that that is how people are approaching it. But we have a lot of there's a lot of push and pull here, and I think that is what produces more anxiety. And frankly, I think our communities will take the lead from, or will pick up on just the culture of our leaders. If our leaders are out there promoting working together, this is how we want to help support you being in person, outside of a school board setting. And here are some ways that we believe that you could do that. And we want to help you stay in school longer. Here are some ways to do that. And so I think a lot of modeling will help with this overall. And I think that it's there again, the spirit of cooperation. We want to work together. We want these same outcomes and goals. But unfortunately, there's a lot of politics involved here. And I know, again, going back to statutory authority, that people feel like, well, why are you telling me how to do that? This is my job. Well, you should be listening to me because this is my job. And I just am always hopeful that how we approach this and how we approach the conversations of, like, let's work together. We both want, all of these groups want things for our students. We want to get students back together, but how we come together, I think, is so important.
Thank you.
This is Chairman Nettleton. Is there any further discussion or questions for Debbie? Well, I thank you, Debbie, and for your input. And hearing none, I will move on to Jim Foudy. Jim, if you have the floor at this time.
Thank you.
Thank you so much. And Debbie, thank you so much for that, all of your work on this project. This has been incredible. And real quick sidebar with, if I may, with Commissioner Hasbrook, prior to March of 2020, the most stressful aspect of this job was deciding whether or not to declare an emergency closure for a snow day. And I'll tell you, COVID-19 sure has put that in perspective. So
it's the same thing with the county too, Jim.
Yeah.
It's like
Yeah.
every day is different.
Yeah, exactly. Yeah, Jeff McFadden phone calls at 4:30 in the morning used to be trigger something, and now it pales in comparison. It's nothing.
Yeah.
Nothing. So let me keep it kind of high level, if I may. And within the framework, if I was to share one thing with you that is driving school district decisions, look at don't look now, but look, if I look at the confirmed case in the school building guidance, what is the school or district's response when we have one confirmed case in a building, right? If you look at that, you're talking about contact tracing, you're talking about communication with families of that classroom in a very, very protected but yet informed way. You're talking about, possibly if the contact tracing takes it out of the classroom and into the schoolhouse, then it goes wider, or the district, or what if that student's brother or sister in another school also test positive? Then if you look at that and you look at the amount, the shift in resources that is involved when we have a single positive case, we all quickly realized that we needed to work backwards from that event to develop our plans so that we mitigate the potential transmission, so that we do everything we can to prevent a single positive case in one classroom. And so that's the challenge, right? So our hope is after this spring, we know that we want to try to get the kids back in the buildings to the greatest extent possible this year. We know that was incredibly difficult on families. We know that the rates of non-accidental injuries to children under the age of 18 were significantly increased. We know that in addition to the statute that was referenced earlier, 33512 subsection 7, there's also a subsection 4 that talks about protecting the morals and the health of our students. And within the protection of the health, we're looking at not just physical health, but mental health. And we know that the prolonged isolation, outside of the schoolhouse and, limiting the social connections has impacted that mental health. And so we have a profound challenge here, but I think we can face it. I think we can face it because we're working collaboratively with each other. We're working with Central District Health. We're working with local physicians. We're working with our colleagues in other school districts. And we're looking at, what are other school districts doing and how did they figure that out? And I'll tell you, even though the days have been long and consistent since the middle of March, when I reach out to one of my colleagues in another district, every single time they answer the phone. whether it's within an hour, or hey, I'll get back to you later tonight. But every single time they answer the phone. And so as we develop our plans, which are, our district's plans are not finalized yet, but we anticipate board approval on or about August 10th. It is with extensive collaboration and support from the framework that was developed, as well as the guidance from CDC and other districts around the state and around the country. That's a high level overview, pretty quick. Are there any specific questions or anything that I might be able to provide some clarification on?
Madam Chair, this is Elk.
Yes, Elk, go ahead.
Jim, thanks so much for being here today. My question, and one of the things that we've learned at the county, is there's a lot of last minute hard decisions that you have to make throughout the day or throughout the week. If someone does come in who's been exposed or even who tests positive. And one of the things we've learned is that isolation or remove those kind of folks or that employee from the building immediately works the best. I know I just went through that here a couple of weeks ago. Do the schools have nurses on staff that can isolate that individual and do that tracing, or is that going to be an extraordinary expense that you guys haven't budgeted for? And where are you going to find those funds? And there's a lot of questions there. I just trying to say you got to be really flexible every day, because every day it's a new scenario, a new issue.
Absolutely. So we have one school nurse position for the district, and then a lot of training, that needs to happen at the direct contact level, the office staff. And so what we're working on is identifying and creating isolation rooms and spaces, and then those protocols where if you have a student that presents with symptoms, what do you do first? What do you do second? What do you do third? And how do you minimize that exposure as soon as possible? We are also, we're working to empower in our district every single teacher with a handheld touchless thermometer, with the sanitizing solutions, et cetera. Those are things that are going to be in place for us. We realize that if we rely solely on an office staff of two, we're not going to be as effective as if we engage the entire team.
Well, and Madam Chair, this is Elton
Madam
again.
Chair.
Yes, Elk, go ahead.
I think one of the things that we have found out that works really well for us is that there's people that are going to be exposed that don't have symptoms, or there's people that may have the virus that are asymptomatic that still want to be involved. They still want to work. They still want to, and maybe in the school's case, they still want to go to school. So if you can set up that isolation room with electronics to where they can actually watch their teacher, their class, continue on with their day and still learn, I think that would be a big advantage, because there's going to be quite a few asymptomatic folks that they're very frustrated. They still want to work, and so we send them home with electronics and a notebook so they can continue their work and they're still productive, and it makes their mental health a lot better if they feel like they're contributing something. And the mental health issue is going to be huge for these kids for a lot of years, and I'm concerned about that more than anything else.
I share that concern.
Did I hear somebody else that had is that Diana?
It is. Thank you. So I guess I want to come back to the resources. Excuse me. Sorry. I want to come back to the resources question. And you noted you have, it sounds like, 2 healthcare staff members for the district. I'm thinking about how some of these companies have handled it when they've had a cluster or a significant exposure, and many of them have literally brought in, a crush the curve to the workplace and done on-site testing. But some of the way that they're obviously able to do that is, first of all, they're adults, And second of all, those employers are responsible often for those employee healthcare costs. Obviously, this is a different situation where student presumably has a different, health insurance, et cetera. Plus, we have a parental consent need. So I'm just wondering, and I guess this is a question for all three of you, both at the district level with CDH and the state board, how we're planning to handle the testing component of students when there is a significant exposure, and are there additional resources that can be brought to bear to make that more streamlined?
May I defer to Debbie while I turn the lights back on?
Yes.
I don't know that I have a great answer for you right now. I think as far as whatever testing protocols are in place in counties, I'm assuming would be the line that parents, and really that comes down to parents. Schools would not be in a position of testing. It would be something that parents would do, and they would take them, wherever those testing sites are. I do know that, as Jim has pointed out, you're going to have superintendents, administrators, teachers, everyone's going to be monitoring the situation day to day. And every communication that I've seen is encouraging parents on here are signs and symptoms. And so I think we just have this, we're going to have a heightened effort to be aware of whether or not someone should be at school that day, whether or not someone should be tested, and you'll see a lot of counsel and advice going to parents and to teachers on what they should do.
Madam Chair, may I add?
Yes, go ahead, Jim.
Thank you. So we're also, I'm not a healthcare provider, and I'm not a testing specialist, obviously. And I am curious about the unintended consequence of mass testing for asymptomatic individuals. And I'm curious what that does to the entire system overall, and what that does to the response time for tests, and what it does to our mindset in terms of any kind of a false sense of security. Those are curiosities on my part.
Madam Chair, this is Ted Epperly. If I can, I'd like to respond to the question that Jim is asking, as well as make a comment to all three of you, and then a question as well. First, Jim, it's going to put a massive overload on the system. I can't tell you if all the schools are sending all the kids through a viral season to their local providers. It's going to overwhelm the system. We're already overwhelmed on testing right now. As I speak to you right now today, we're doing hundreds of tests, and it is taking 4 to 10 days to get back. It's almost meaningless if it's beyond 7 days. And that'll only intensify in the school scenario, because nobody wants to have a sick child maybe spreading to other classmates or to the teachers. So it presents a real significant challenge. And I'm speaking now as a physician, and I can tell you we're going to get overrun. In some ways, we're kind of overrun to a certain degree right now with this in terms of being able to keep up with the testing, let alone if asymptomatics really get thrown into the mix. That said, I wanted to just make one comment to the three of you, and then one question for the three of you too. The comment is, and I know all of you are aware of this, that up to a third, maybe even higher, of the children, especially the younger the children, the more asymptomatic they're going to be. I think it's going to be really important for the schools to ensure masking happens. And part of the challenge of that is to make sure that those asymptomatic kids who don't know they're sick won't be screened by the school nurse or by a teacher for being potentially sick. They'll be a potential spreader. So the masks, I think at a minimum, if we do just one thing from a public health perspective, the masks will be important. Mm-hmm. Having said that, now my question to the three of you. You know, I mean, this is a complicated situation we're all in, as you've all well said. How are you going to approach this, the communication plan back to parents, so that once the local school board makes a call on this, and you know, certainly we'll provide health information in terms of percent positivities to help inform the three categories of transmission in the community. That's our job here. But speak to me just quickly about the communication plan back to parents, because that's going to be critical for every single one of those families. 75,000 school children in Ada County, let alone what we have in Valley County and Boise County and Elmore County. How are you all going to go about the communication plan of this?
Madam Chair, if I may.
Yes, who's speaking, please?
This is David Reinhardt from Kuna Public School District.
Okay, thank you, David. Go ahead.
Thank you for having me, and to speak to Dr. Epperly's question about communications. I think it's a good. I assume you're talking about moving from one stage to another, or what our status is going to be. We have a number of avenues to do that. We do have a small, first of all, texts are instant to our families. We have a small newscast also that gets some good traffic during the school year. We have a number of means of doing that. I guess the trick is making sure our message is right and making sure our message is aligned with not only Central District Health's and the state board and kind of all of our other layers of input, but that we're also communicating constantly to the other superintendents in the Treasure Valley and our region, and with those people we collaborate with. Our families, 75% of our families disappear from Kuna every day and go to Meridian, Nampa, and Boise to work. And so we're not isolated. And so even if we don't have any cases in Kuna itself, our families are interacting in areas of higher spread. So we have those vehicles, and we have a person whose job it is to communicate. We're fortunate enough to have that. So. Does that help answer that question?
Yeah, David, thank you for that. Yeah, it's a challenge.
Any further questions for Jim before I move on to David? Well, hearing none, David, you have the floor at this time.
Thank you, Madam Chair. Thank you for having us be a part of your meeting today. I first want to speak on behalf of Kuna Public School District. We are a school district of about 6,000 students. We have about 600 employees. As I mentioned, our families are largely work in, we are a bedroom community, and we are, as was mentioned, a growing community. We have I first want to give a shout out to Gina Pinella and the team at Central District Health. They've been incredible resources through this. They've especially helped us when we've identified a case in our community or amongst our staff or students through the summer months and spring, and helping with contact tracing and helping us navigate how to do quarantines, isolations. and to developing this plan. So between the state, between Central District Health, the state board, and the governor's office, really, and our collaborators, we feel like we've had great support all the way around us. We have a plan similar to other plans in that it's color coded, it's green, it's yellow, and it's red. Our board has at our last meeting established that we will be starting in the area that is yellow and is to proceed carefully, that there is some widespread transmission. And so we are currently, we have two options really now between bringing all the students back and probably the thing that we're probably more inclined to right now and going to bring to our board is a hybrid model where half of our students will be at the school at any given time. And when they're not in the building, there'll be education online. We've also moved to a one-to-one device so that online can happen in the home regardless of their economic status. And we also have in safekeeping our plan in case there's a large spread in which all of our learning would move to an online situation. I think President Critchfield really said it best. Education it never stopped. It continued in March, and it will continue. In fact, it continued all summer with summer school, and it will continue into next year. It's a matter of how we're going to do that. I think in terms of, there's been some discussion on face coverings. We are requiring face coverings because of the Ada County order for faculty, staff, and students. We continue to receive guidance on what that looks like and how to do that. But our plan does include that as a protective measure. We do have some concern about how to handle the students that we anticipate morning to noon show up with a fever, show up with some sort of symptoms, show up and say, Mom has coronavirus or Dad has coronavirus, or I was on the playground with somebody. We're asking while there be training for everyone, we're asking our security or safety aides in the buildings to receive extra training, and St. Luke's has partnered with us, and we're appreciative of that. But we're still concerned about how to handle the safety in the building. We're really adding to their job description, safety in the building and handling the students that we anticipate coming down to the office many days, if not all days. And so we're working through that. I wouldn't say we've arrived at that answer. Beyond that, I think there's also a question about what's the difference between how an elementary school operates and maybe a middle school and a high school, and that is different. We have 7 elementaries. We're opening our second high school this year, which is an interesting time to open a high school. We're already about a month delayed on that because of COVID. Some of the crews have had setbacks, but the way they eat lunch, the way they change classes, the way they, or even the classroom settings and the amounts of people they interact with every day are quite different. Our high school is going to be approaching 2,000 students, and they switch classes 4 times a day. So, and eat and have one common lunch at this point. So I would say that we feel very supported in our decision making. We're trying to keep the board informed, but not overwhelmed with the details because things change so fast. And we, like all the districts, are keeping safety the safety of our students and staff as primary, but it is a daily job. And I think, like Superintendent Foudy, we also are concerned about when someone's identified the resources that it's going to take to address that situation. And the concern is then are we taking our eyes off of the important task of education? So there's a balance that we're trying to strike as well. With that, I will end my talk and stand for any questions.
Madam Chair, this is Del.
Yes, El, go ahead.
David, you know what we're seeing, not just up here, but throughout a lot of the state, is a lot of families are anti-mask. And we instituted a policy right off the bat in our local courthouse that if you want to do business in the courthouse, you got to wear a mask or you can't get in the building. And you're going to run into those situations where you have students that are not going to want to wear a mask, or maybe even mom and dad won't let them wear a mask. How are you going to handle that? Because those are sticky. Those are really tough.
Yeah, so those, and again, we haven't really gone through that. Our athletes through the summer have been good about wearing masks when asked. There are moments during their practice that they're putting some face covering on. I think that's also a concern with resources. You know, when you have maybe 2 people in the office and a principal, that becomes, you know, it's a whole other layer of addressing it. What I can say is we're working through that. I don't have an answer. I was in a restaurant recently, and because it was in Boise, they have a mask mandate, and the person behind the counter handled it very well. It just simply said, "Would you like one? I have one for you." She said no, and she just simply said, "The next time you come, please come with a mask." The lady happened to be on her way out. I think we're going to have to find that, how to address that in a way that doesn't take up our whole day. So in other
Madam
words,
Chair.
Madam
I don't have
Chair,
an
this
exact
is
answer.
Representative Blanksma.
Yes,
Madam
Megan, go
Chair.
ahead.
I just had a quick question for one or all of you. I've got 2 teenage children, and if we're talking about worrying about whether they'll be willing to wear the masks, I have yet to find a school that doesn't have certain clothing policies as it is. Do you envision that just the mask becomes, if that's something that is a requirement by the school district, that just becomes that similar type of policy?
Exactly. It's same with staff. Our staff has been wearing masks through the summer in public places, and we treat it the way we treat other safety gear and dress code.
Madam Chair, if I may.
Yes, who's speaking, please?
Sorry, this is Superintendent Foudy.
Oh, yes, go ahead, Jim.
Yeah, so just I'd agree with David as well. Like we won't necessarily need to change our policy. The requirements will be stipulated in our basically pandemic operational plans, and we'll follow those accordingly. But I will say this, just for consideration, one of the things that we're really considering is, you know, are there any times of the day when masks would not be required, and what protocols, procedures, conditions can we influence to where we could set up a situation where masks are not required? From a lot of standpoints, that seems to be something in which we're headed in the right direction. And I think it makes people more mindful of the space that they're in. If I'm out on a practice field and the next nearest person is 20 feet away, Should a mask be required? And perhaps that's the time where I could take it off. And then now I'm more mindful of what happens when I go indoors and I'm in a space where there's not as much fresh air, et cetera. Then now I'm going to put the mask back on for safety reasons. That seems to be an approach that's resonating with a lot of people.
Madam Chair,
Thank
this is
you,
Elt. I have another question.
Yes, Elt, go ahead.
I was reading, we got, I think last night I got 238 emails on this very meeting today. And one of the suggestions of, I think the person was a teacher or maybe an elderly or a retired teacher, was the fact that, we take the kids and we move them over to another classroom for another subject to study. Have schools thought about, instead of moving the kids, just move the teacher to reduce that exposure and keep the kids in the same classroom all the time? And I thought that was a pretty reasonable question. I don't know.
Yes, Jim or David, would you respond to that, please?
Madam Chair and members of the board, yes, we have and are looking at that. We're asking our principals, because an elementary school is so different than a high school, to look at ways to keep those cohorts together. So, for example, it might look like recess is all of first grade at one time, that perhaps it's one of those elective teachers or those specialist teachers like the music or PE or somebody comes to their classroom, or they find a way to minimize that kind of intermixing, so that if one student gets sick, it might just be the first grade that's affected, not the entire school. High school level, it's a little different. Again, that's why we turn some of that back to our principals and say, okay, we want the least amount of interaction and cross contamination, if that's the right word, to happen. And so can you, to the principals, can you think of the way your building's laid out and the way your classes run, that you could minimize that? At the high school level, it's pretty tough, because you might have a student in you might have two students in an advanced math class, but then one chooses to take an elective in ag and another one in construction. And after their advanced math, there's no way to bring those two different teachers to the room. There's just going to be some movement.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So I think clarification again back for Debbie, and then maybe more of a statement. So I want to go back to our assigned roles in the back to school framework. And if I'm again interpreting this correctly, it's not our job as the Board of Health to micromanage within the school buildings, how they operate different things. Our job to tell them if we are in green, yellow, or red. So, for example, in Ada County at this time, are we in minimal to moderate transmission, or are we in substantial transmission? And we now have guidance that health and welfare and all 7 health districts have developed in terms of those criteria. Am I, again, correct based on what our role is?
Yes. Just to reiterate, the framework was put together for public health to establish the categories, and with that information for school districts to determine how they will deliver the education.
Okay, thank you. So I guess with that, there's just been, I don't know, various emails and maybe rumor mills going around about, how these decisions are getting made. I think it's really critical for us to note that this board has not as a board, at least, kind of reviewed that data yet and said which of these categories we are in. And I expect to have that conversation with, with Russ and team and as a board.
May I ask a follow-up question or a question to your question, Diana, Madam Chair, if that's okay?
Yes, absolutely. Go ahead.
So within that role of determining the categories, considering that you take in a wide variety of school districts, I don't believe that we approached it that it was a one size fits all, that those determinations and categories could be different from area to area. I just want to make that clarification that it's not everybody is in red or everybody's here, but you have those localized conversations.
I concur. Sorry if I was confusing. It's
No, I just wanted to make sure that my answer didn't portray that.
yeah, and that's how we've operated as a board. What we are seeing here in Ada County is different from what's happening in Boise County.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Yeah, a question again for all three of you. And I think it's really clear, and I'm glad we have talked through this, our roles and your roles. And let me just say, I'm a big fan of the educational system. You know, we've all gotten to where we are in our life because of schools. They've been deeply meaningful to all of us in a lot of different ways. If, and I'm just going to use a hypothetical here just to frame the question. We know in Ada County right now and in the whole Treasure Valley, we have substantial community outbreak. Are the school boards flexible in their thinking in regards to recognizing that after this conversation we're having now, and as we deliberate the percent transmission and how we start to frame the criteria of what constitutes minimal to moderate community transmission and what constitutes substantial community transmission, am I hearing from the three of you, Debbie at the Idaho State Board of Education level, and Jim and David from you in your local areas, that the school boards are prepared if we give a percent positivity or other criteria that places in the substantial community transmission, that you're both capable and ready to act on that with appropriate hows and whens to face the situation, recognizing that it is targeted, that what might apply in Ada County will not apply in Boise County and or potentially in Elmore, et cetera. I just want to know what you're sensing from your local district boards around this decision in terms of what constitutes substantial community transmission.
Madam Chair, may I?
Yes, go ahead.
This is Jim Foudy, Superintendent McCall Donnelly. We're very curious about that definition from the standpoint of, okay, so let's look larger. McCall Donnelly is part of Valley County, and hypothetically, let's say we have a situation where there is substantial community spread as defined within Valley County, but hypothetically, that community spread is actually isolated to Donnelly and not McCall, or take it to Ada. You know, hypothetically, let's say that that Southwest Ada happens to have substantial community spread, but it hasn't hit the north end. Will your guidance, Dr. Epperly, and perhaps to the board, is it going to influence an entire district or an entire county when perhaps the issue is more localized and more targeted?
So, Madam Chair, if I can.
Yes, go ahead, Ted.
Great question. That's something I think for us to talk through as well. I think I'm certainly a fan, Jim, to your question, of having this be very targeted. so that it minimizes the impact on as many people safely as is possible and all those families. So I think we're going to the best of our ability, have to be able to target it. The problem is that with all the testing being done, it's very difficult to get this down to a particular isolated school within a school district, let alone within the county. So there are some inherent challenges of what the percent positivity in the community really means in terms of what does that mean for elementary school A, middle school Y, or high school Z. It's going to be a bit of a challenge, I think, with that.
Madam Chair, this is Debbie.
Yes, Debbie, go ahead.
I just want to share the experience of the soft closure. And this is not a hypothetical. You will have, I believe every district will be receptive to your consultation. They will look seriously at the categories that you place them in. But it is not a hypothetical to say that you may see responses that you don't agree with. That school boards will act with the authority that they have as elected officials on delivering the education, and it may not match the response that you have. And we've seen that through the period of again, the soft closure. Now we had some other, the governor's orders, but when it comes to public health and locally elected officials, we want to encourage cooperation in the category and the responses, and that we all feel good about that. But the reality is that in addition to you providing advice, and providing the category information, districts will and may choose to do something different than what you would have had them choose.
Madam Chair, this is David Reinhardt from CUNA. May I answer the question?
Yes, David, go ahead.
I don't want to pretend to speak for our board, but I can say is working in the district office and bringing information to the board, I think they would take that information very seriously and cooperate largely without you weighing in on the metrics, without you giving us good metrics and a good sense of where our community is. We're watching the same TV and looking at the same websites that everybody is, and it's fluctuating so much each day. And we would really appreciate the guidance of our health board. And we also have students in Canyon County as well. So we have to take that health board's opinion to bear as well. But yes, we would welcome your input and welcome an exact laying out of the metrics to help us bring those to our board.
Thank you. Are there any more questions or discussion for our three speakers today? Well, hearing none, this is Chairman Nettleton again. I will express the board's gratitude for all of the hard work and your time today as we try to move forward with this challenging situation. So thank you again, and we do appreciate your efforts. So we will be moving on to new business item number 3, which is a discussion and vote regarding potential action to protect the life, health, and safety within the district as to the COVID-19 pandemic, to include potential amendments to current public health orders for Ada County and consideration of orders for other counties or communities within Public Health District 4. The floor is open.
Madam
Russ,
Chairwoman?
would you like to weigh in? I'm sorry, is that Megan?
Yeah, this is Megan. I would
Megan,
just
go
like
ahead.
to make a quick comment, because I mean these meetings have been kind of dragging on in the evenings, and as you all know, that I'm not the best at sitting through meetings, but I think in light of the fact that, as I understand it, and Russ, please correct me if I'm wrong, that you're going to have actual metrics and standards as to how, which sectors this red, green, and yellow differences as far as community spread and other factors. If I understand correctly, that's supposed to be available on the 3rd, and that was something that was discussed by all health districts so that there is something more standard as far as judging what sort of protections would need to take place or information that should go out for the public. And if that's accurate, I would really prefer, before we do any additional orders, that we wait, and so that we at least finally have a standard on which to judge what we're doing.
Russ, are you there?
I am, Madam Chair, and I can speak to that. So, Representative Blanksma is correct. The levels of community transmission, they've actually been around since prior to us having our first case here in Idaho, published by the Centers for Disease Control. The part that has been absent since then is a clear definition of what are the criteria that we're going to look at and make that determination of which category, whether you call it green, yellow, red, or category 1, 2, or 3. So we have that now. I did share that with the board. I'm not sure if the state has made that public as far as putting it on their public-facing website yet. It is a document from the Department of Health and Welfare. However, with that, there's some subjectivity to it, like there always is. It's not a specific number, not a specific positivity rate. There's a number of factors that have to be weighed, and that's something that we here at Central District Health will be doing for that August 3rd time frame that we're looking at, so that each of our school districts understand which category we're going to designate for them, so that they can then make the decisions how they operate, from busing to lunches to classroom, hybrid, et cetera. That'll be a determination they'll make based on what we provide. And the school boards will make the decision whether or not they follow the framework to a T or they don't. As Debbie mentioned, that'll really be that local decision. We're going to offer the category. And in addition to Commissioner Lasciando's comment about that, she's exactly right. That's one of the roles. But the other role that we played all along is we do provide advice and guidance on operation and safety plans. That'll continue. Gina Pinnell's name was brought up earlier, and she's been doing that for all of our schools as our school liaison. And of course, on the disease investigation side, which is Kim Link and her team with contact tracing. So that's all in place now. We're going to work through that process. As far as the orders themselves, the question came up as to the mask requirement, face covering requirement for public places. And a public place definition in the order required a specific, did not require a specific invitation. So whereas a school clearly is a public facility, but as we've talked, for somebody just to walk into a school, walk into a classroom, it's not exactly a public setting. So as we were getting questions about that here at the Central District Health, my recommendation was to provide clarification that it does in fact include schools. So that is what we published on Friday for the public to see, and you'll see that in yellow. And then there were other conversations that I had with just individual board members about including childcare, and that's noted in blue. And then the green was the idea of everyone in a primary and secondary education, basically K through 12, would be required to wear a face covering with a few exceptions. So those were additions. And again, it's just for the board's consideration, but the yellow part of the published draft is to provide clarification that face coverings requirement are applicable to our educational institutions, including higher ed, technical schools, colleges and universities.
So, Madam Chair, this is Diana.
Yes, Diana, go ahead.
I think we can clarify the mask piece, but I don't put the cart before the horse, because for me, I think it's a lot more critical. We have these guidelines that have been released now about what these definitions are of minimal to moderate versus substantial spread. And I think it would be, and I know the public is very anxious to understand this. I think our time would actually be better spent to talk through some of that at this point, because that is going to have more of an impact on when and how schools open versus the face covering component.
Madam Chairman, Mike Kane, can I get in on this?
Yes, Mike, go ahead.
Basically, I don't set policy, I just give legal advice. Based upon what I'm seeing here on the publication that occurred last Friday, I'm going to strongly recommend that you wait and take a step back and take a look at not only the guidelines that have been published, but also as to where you're going on what exactly a child care facility is. And that can be interpreted quite broadly. And as to whether or not you want to set up a 10-foot spacing as you have in your green there, whether that's science-based, and whether you want to include the colleges and universities, which you have not heard from, to my knowledge. I think that Representative Blanksman's idea is extremely well taken and should be strongly considered, and that's my advice to you.
Thank you, Mike.
Madam Chairman, this is Ted Epperly. A question, hearing that back to you, Russ. With what you've proposed here as some modifications, which to my reading make a lot of sense, but recognizing that we do want to make sure that we get it as right as we can. The 10 feet, by the way, Mike, refers to the amount of distance in a classroom if a teacher is unmasked, so that we create a space around that teacher that doesn't potentially infect a student, although a face, a shield could be worn or something like that. I just wanted to make a comment here. We're not trying to change social distancing issues. We're just trying to clarify, if a teacher's in front of a class speaking, what does that look like? But having said that, Russ, the question back to you is, these things seem to make sense in terms of the modification. This isn't taking us off in some, significantly different direction. Are you facing enough uncertainty or confusion in the community to take an action on these now to clarify? Or are you saying that these are suggested considerations for modification of the existing order, and we'll take this under advisement as we start to work on the criteria around minimal to moderate community transmission and substantial community transmission? Russ, that's a question to you in terms of preference.
Madam Chair, Russ?
Yes, Russ, go ahead.
Yeah, Dr. Epperly, what it really came down to was the original order that included face coverings, requires face coverings in a public place. So that's spelled out in the order, and that was a conversation that led up to that meeting and that decision. And public place shall mean any place open to all members of the public without a specific invitation. So in that, we include educational institutions, but those could be viewed as other educational facilities, like a library is certainly an educational facility. So because of the specific language around specific invitation, and Mike Kane, who's our legal counsel, who's on the call, he feels like that does in fact include schools. Now, obviously we have the discussion, does it include colleges, universities, and technical schools? So the question I would ask the board is, what was your original intent? Was it your intent to include K through 12 in that original order? Was it your intent to include K through technical school, college, and university? And if the answer is yes, I don't see any harm in making that crystal clear because of the question about the definition we have in the order of public place being open without specific invitation.
Madam Chair, this is Ted Epperly. If I can comment to that.
Yes, Ted, go ahead.
Thank you, Betty Ann. As the maker of the motion, my intent in making that particular motion is that it did apply K through 12 and onto colleges, universities, and technical schools. This was a large gathering of people in a public place that would be best served by having face masks worn. That was the intent of the motion. It was absolutely to bring to bear the most important single thing we can do, which is to face mask individuals, both for their protection and protection of others. And that was the intent of that motion.
Madam Chairwoman, this is Representative Blanksma.
Yes, Megan, go ahead.
Thank you, Madam Chairman. Well, I appreciate that that may have been the intent of the motion maker. Clearly, that wasn't made clear at the time of the motion. I think also we have additional information now available to us, or at least will by the 3rd of August. And I think it would be foolish to expand a mandate without taking in the additional information that would be available to us. I think that's important. I think that more than anything, what we're getting on a lot of these emails are people screaming for some standards and some data and some understanding as to why these mandates are coming out. And I think expanding a mandate when we know there's data coming is not the most responsible decision for the board.
Madam Chair, this is Diana. So,
yes, Diana, go ahead.
Thank you. Sorry. So maybe I'm a little confused here, but is there additional sideboards, definitions that are coming, Russ, beyond already sent?
Madam Chair.
Yes, Russ, go ahead.
So when you say additional sideboards beyond what I already sent, what do you mean by that?
So I'm reviewing the levels of community spread for Idaho Back to School Framework, and that takes the 3 categories and then defines them, which is what we've all been waiting for, was the seven health districts plus Idaho Health and Welfare to agree on what those 3 categories meant. And we've now had these in our email for a few days, and I think it's on the state website. So I don't know if Representative Blanksma is referring to additional data. I don't know what we're referring to.
Madam Chair, if I can clarify.
Yes, go ahead, Megan.
Thank you. What I am saying as far as additional data is that we will now at least have some clarity as to which counties or which areas sit in which conditions, which we don't have right now. And I think that's important because we have yet to figure out how we are going to classify how to get out of a mask order or out of the category 3 that Ada County is in. And I think that once the counties in our district, the areas in our district are provided with clarity on where on that schedule they sit, I think it's going to be a lot easier for us to make decisions. And right now we don't have clarity as to who is sitting in what category. We've got the categories set up. We now know what data we're going to look at to define the categories. I think it would behoove us to find out where everybody's sitting so we could make some educated decisions.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
This has been made crystal clear. The order as is specific to Ada County. It doesn't, It doesn't involve other counties. And it's very clear around calling for face masks for all participants, all people that cannot maintain a 6-foot distance in all public locations, all locations. And this is this isn't, now let's not conflate two different issues here. The issue around identifying the level of transmission risk into category 1, 2, and 3 is another piece of work that we need to do. That data will help inform the school districts. What we've done to this point in time are several things that have been really good for the health, I think, of Ada County. At least the data is starting to show this in terms of reduced transmission. That was taking Ada County back to level 3, not Boise County, not Elmore County, not Valley County. And then we built on Mayor McLean's Boise City masking policy to make it specific only to Ada County. We couldn't have been more clear in regards to both the targeting and the rationale. We have significant, substantial community transmission with percent rates over 10%. So I think that what we need to do at this point is clarify the existing orders to the best of our ability to do so. And that's what Russ has proposed. It's been in the public. It's actually not much of a modification. The public has seen that. We've seen that. This isn't a wild stretch of new data or new metrics. And then we either act on that or we table that. But again, it just leads to confusion. This whole discussion is leading to more confusion, which is part of the problem in the community about, are we serious or not about masks? As we then identify the level of transmission risk, which is going to be some metrics specific to community transmission that we can share back to the school districts. So we're talking about two different things here, and we can't undermine what we've done in regards to moving Ada County back to level 3 and the importance of masking. That would be a step in a backward direction on this issue, and I'll stop.
This is Chairman Nettleton. I would like to comment too on the portion of this order that is in blue regarding child care facilities. Mike Kane mentioned this briefly. One thing I have a problem with is right now our order states that anybody over the age of 2 with the defined exceptions has to wear a mask. While this may be idealistic, it in reality isn't going to happen to keep a room of 3-year-olds wearing masks, and I just I'm very concerned about the problem it would create stress-wise for those child care workers and the behavioral problems it would create in the children. So that said, I will stop there. Any further discussion?
Madam Chair, this is Jane.
Yes, Jane, go ahead.
I feel very strongly that we need to clarify the order that Dr. Epperly was talking about to help make our message clear so that we are working to decrease the transmission, which is our prime goal.
Any further discussion?
Madam Chair, this is Eld.
Yes, go ahead.
You know, it's interesting because coming from a small county where we certainly don't have the problem that Ada County is going through right now, but one of the things that I've noticed the last 2 or 3 weeks is that I have business owners coming to me asking for a mask mandate, because that way that takes the political pressure off of them. If you want to go into their business, you have to wear a mask. And quite a few of them have asked for that, even though I think we're still only in category 1. I don't think we're even close to being a serious outbreak yet. So I want you guys to think about the other side of that equation. Is this gives our business owners a little bit more authority on who can enter their business and who can't, even though, you know, like I said up here, we don't have too serious of a problem yet. Just another perspective.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So to that point, having spoken with school district leadership in all 3 districts in Ada County, as well as school board members, they actually really appreciate, they appreciated us coming out with the order. It took it off their shoulders. But B, the more clear we can be, the better, because as we noted from some of our school district reps who were just here, ultimately they're the ones who are going to have to kind of engage this with their parents and their students. And so the clearer we are, is the better. That being said, the question about childcare facilities, I'd be ready to punt for another day. I think that there's a lot of problems trying to get young children to adhere to a mask. And I think it might behoove us to punt that for at least a week, and also kind of with the mind toward thinking about who's really carrying that viral load, as we know more and more that it's really those older students, for example, 10 and up, who have the same level of infectivity as an adult.
Madam Chairman, Mike Canahan, can I follow up on that, please?
Go ahead.
Childcare facility, the way it's written now, would include licensed daycare centers, hospitals, juvenile correction centers, children's camps, foster care settings, and numerous other settings that perhaps you're not thinking about. And I think it does strongly bear further definition.
For the record, all of our kids and staff at our juvenile detention facility are wearing masks, with or without it.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
We're in the midst of the biggest pandemic in our lifetime. We have substantial community spread. Let's not step backwards here. I think that clarity going forward, not clarity by delaying, is going to be essentially important. What Russ has in the orders before us that are available to the public can see this just as we're seeing it right now. There is nothing in here that we've not discussed in a meaningful way. I'm okay if we want to sidelight childcare facilities for the time being so that the whole thing doesn't stop. But there's nothing in here that is a major regression or some sort of confusion about what the public understands about what we're trying to do with masking. This is an important moment for us. We've shown leadership in regards to moving this forward. This is not the time. We're in substantial community spread of a major pandemic that now are starting to fill our hospitals. We're seeing increased deaths from this. We all knew this was going to happen. It's now happening. What I would propose is that we further clarify this order with the exception of childcare facility, as we've been given by Mr. Duke and was published to the community on Friday of last week, and that we move forward with what is here as a considerable continued clarity of order. And we will then tackle the issue of the level of transmission risk in terms of what the criteria are for that, so that we can give a pretty to very clear answer to the schools around what that looks like. But again, these are two different things. The face mask is what we're asking, the face coverings for clarity around orders. I would propose and make a motion that we approve what's written here with the exception of childcare facility so that we can take a deeper look at that. I don't think there's any sorts of institutions that Mike Kane has just mentioned. It's outside of them already thinking that this applies to them. And that we then also take a look at, but not probably on this call, we probably have some data done and performed so that we can make the best call we can on the identification of level of transmission risk so that we can inform the schools around categories 1, 2, and 3. And those are two different things. So again, in conclusion, I would move that we accept the modification of the orders with the exception of childcare facility, and that we continue the pace of moving this forward around clarity. This is a clarification of the order. We don't want to confuse the order. And I'll stop.
Okay, you have all heard the motion. Is there a second?
Madam Chair, this is Commissioner Laciato. I will second that.
Is there any further discussion before I call for a roll call vote? Hearing none, I will call for Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye. Ted Epperly, aye.
Commissioner Laciando, aye.
Elmore County.
Representative Megan Blanksma, no.
Okay, thank you. The motion does pass, so Russ, you have your instructions to go ahead with this. So, is there any, that being the final agenda item today, any other comments before I call for a motion to adjourn?
Madam Chair, this is Commissioner Laciando. And I do want to just reference something that Representative Blanksman noted. I think we are getting closer. We are homing in on more data. And I want to kind of put a question out there for the Central District Health staff. I've had a number of bar owners reach out to me, and they are confused or concerned about what our orders mean and how long they may be open or how long they may be in place for, which is, as we noted, a difficult thing to say at the beginning because it's really the virus when we move forward or backward. But that being said, I'm wondering if the board and perhaps Mike, or excuse me, or Central District Health and perhaps Mike Kane could do some research on how we would further clarify bars versus nightclubs. We do know that in Ada County, we have some restaurants who might actually be acting more like a bar right now, or a nightclub. And we have some bars that are just a neighborhood corner bar and don't have that many people in it. And I know this has been a struggle. It was a struggle from the moment that this was released in the Rebound Idaho plan. People were kind of opting into the definitions as they saw fit. But in terms of, and I don't want to put words in your mouth, Russ or Ted, in terms of the public health risk with the number of people who are there, the loud music, the close talking, we can have very different levels of threat, if you will, depending on how those things are actually being operated. So could I put that out there as a maybe a homework assignment?
Thank you, Diana. That we would have to add that as an agenda item for our next meeting. Is how I understand that. So, thank you for your input. Do I have a motion for adjournment?
Madam Chair, this is Jane. I move to adjourn.
Yes, thank you, Jane. Do I have
Madam
a
Chair,
second?
this is Commissioner Hasbrook. I'll second.
Thank you, Elt. I will call for a roll call vote for adjournment for Boise County,
Commissioner Sturm, aye.
Valley County,
Commissioner Hasbrook, aye.
Ada County,
Jane Young, aye.
Ted Epperly, aye.
Commissioner Lachiondo, aye.
and Elmore County.
Representative Megan Blanksma, aye.
Okay, thank you so much for everybody's participation today and the public that has been listening in. As we move forward, our next meeting is scheduled at 4 o'clock on August the 4th. So have a good week, everybody, and the meeting is thus adjourned. Thank you.